Hey, welcome. I'm glad you decided to join us again on this continuing journey on staying healthy during these trying times. They're not new trying times in the sense to humanity. We've gone through difficult things before and we have survived and learned to excel. And today we're going to talk about some things we can do when we are diagnosed, if you are diagnosed with the coronavirus, COVID-19. And there's so many different things we can talk about. We're going to overview on several of them. And if you want specific information, I'm definitely willing to help you out there. First, if you've gotten anything out of this, please send me a little note saying you're benefited from it, or share it with your friends, because we need information. Information is power, and we need good information. Information is changing all the time. The science, our understanding of medicine and science is constantly evolving, but we need good information, reasonable, practical information. So we're going to talk about 10 or so things that we can do if we have come down with the coronavirus. As always, though, you need to consult with your own physician. We're going to talk about some things that you could apply to your life, and some of them, many of them, are pretty safe, but there's always caveats to that. And we need to be aware of what those are with our own health, our heart disease, and things we might not even know about that could be affecting our health, especially when it comes to taking supplements or herbs. And we'll talk about a couple of those today. This is kind of important to just briefly go over again, because we're going to talk about research. And some of the things have strong research, meaning they've made it all the way through the animal trials and in vitro and test tubes. And we know how they work based on that, and population studies and randomized controlled trials and placebo controlled things. So there's varying levels of evidence for the different things we're going to talk about today. Keep that in mind. So when should you see your doctor? The Mayo Clinic makes it clear. They set out some really good guidelines probably based on the CDC. It's if you have trouble breathing, it's like the number one big thing. If you have trouble breathing, shortness of breath, or difficulty breathing is a little bit different than short of breath. You can be short of breath and still be breathing fine, but difficulty breathing, it's either having a hard time coming in or a hard time getting out. Chest pain or pressure. It might not even be the coronavirus or something else. It could be heart attacks. In fact, heart attacks have gone underreported since this all started because people were afraid to go to the hospital. An inability to stay awake. That happens to me every afternoon if I sit down for 30 minutes, but that's not what it's talking about. Your normal ability to stay awake, any confusion, new confusion that is beyond your normal. And the last thing on there, blue lips. If you haven't been sucking on some great popsicles, it's probably a good idea to see the doctor if you have some blue lips persisting. So, I just go over a couple of things related to the phase of this, because it's sort of important in understanding what we do when we do it. The phase, you have the infection phase that you get exposed and the virus is replicating. And that starts, week 1. It could be up to 14 days, but typically we see it around 4 or 5 days. People start to develop symptoms. And then you probably detectable by PCR, which has its own issues. And I might do, if somebody wants me to go into why PCR might not be the best thing at this current time because of certain standards we have, let me know. I'd be happy to go into it. And then, the antibody detection phase afterwards, after you're probably no longer infectious, you can detect antibodies. So this is another way of looking at it. The viral replication phase, there's the viral debris, which would be, in the antibodies and things left behind. And then the inflammatory phase. That inflammatory phase is where the lungs and organs and other things can end up getting damaged, where we see that cytokine storm, and we see all sorts of things that that are really directly related to death relating to COVID. That's where certain medications will come in handy. You have your antiviral medications and herbs and supplements and things that may play into that picture. We'll take a look at that a little bit. And then you have your anti-inflammatory side of things. We need to modulate those systems, because we want some inflammation occurring early on, because we need inflammation in order for our bodies to respond properly to this virus. So what a practical thing you could do. I mentioned how breathing is so important. I hope you can read my handwriting here. Pulse ox looks at your the saturation of oxygen and your pulse. So when you do a pulse ox, you want to sit down first. You want to rest for a minute or two, make sure you're at a normal resting heart rate. And you want to check your oxygen and compare it to what your normal is. For me, it's different than you because I already have a lung disease. So my normal is already a little bit lower. So am I at my normal or am I decreased from that? Some general ranges that we go by is 95 to 100 is typically considered good. It's typically considered within the normal range. 90 to 94 is sort of a caution range, depending on who you are. It might be more of a caution than it would for other people, because some people with lung disease can what we call decompensate rather quickly. And anything below 90 is definitely of concern. And also depends on the altitude. The altitude at which you're at is one of the big questions. If you're at a higher altitude, you're going to be maybe at a lower, especially if you haven't been there for weeks or months, at a lower starting point to begin with. The accuracy of these $20, $30 devices is really questionable. There is a study I recently looked at. I looked at 6 of them, and 4 of the 6 were outside the FDA's standard for pulse ox compared to hospital pulse ox. And so that's not very, I don't know. I'm not really encouraged by that. And most doctors are using in their office ones that are not approved for medical use, because the approved medical use ones are like $3,000 or more. So we use not me, that's what surgeons use in operating rooms. And I understand the need for it in that case. This is more of a screening tool and for you to monitor what's going on. One little trick that's important is not to have fingernail polish on. That's very important. It won't read properly if you have fingernail polish. And also give it to somebody next to you to see what their reading is. If their reading is at 97 and yours is 87, make sure it's on well and, on correctly and everything, and no fingernail polish, then there's probably a significant problem. And always, you might be breathing fine, but your lips are starting to turn blue, or somebody notices it, or your tongue is turning blue, or you notice something along those lines, and you need to get help as quickly as you can. In that case, your emergency department would probably be the best choice, but call ahead. Let them know you're coming in and what's going on. So we have our SpO2 and monitoring our breathing is a simple thing to do, regardless of if you have significant or severe. And I want to mention too, about 80% of people who get this have nothing complicated associated with it. It means 20% do. And most of that 20%, it's not significantly complicated. So if we could prevent people going from having no complications and keep them there, or having mild complications and keep them from progressing further and bring them back to having less symptoms and less problems from it, that's really what treatment should be targeted at. There was a doctor, I didn't bring the quote into the presentation, but man, there was a patient who wrote to a doctor and said that her doctor said to her that as long as her lips weren't turning blue, there was nothing they can do. I 100% disagree with that. Now, I have no idea why the doctor said that or what the doctor said, but I 100% disagree with it. One of the things we can do is monitor before it turns blue. If your oxygen sat starts to go down, you need to get help. But sleep is one of the key things we can do, when even prophylaxically preventing it is prophylaxis. 7 hours of sleep has been shown to boost our immune system response to infection and to vaccines as well. We get a stronger, more robust response if we sleep 7 or more hours. It's key. And what's critical in that is the hours before midnight. That sleep, that early sleep, that first few hours of sleep is really important for our immune system. So curl up with your kitty cat if you're a cat person, or your dog, and unless you have allergies to those things, that's not real good for your breathing either. I am neither a cat or dog person currently in my life, but I like both of them, especially when they're somebody else's, and I just get to pet them and have fun and go home. But if they bring a lot of people comfort, so cuddle up and sleep for 7 to 9 hours. It'll be helpful. Obviously, food, me and food, healthy food. These foods, these colored foods you see here, have so many antioxidants. And if you remember back where that inflammatory phase, which is the majority of the problem with coronavirus, that inflammatory phase, we need antioxidants that are safe and mild and yet just integrated into our bodies. And so these anti-inflammatory foods, all these colored foods, are so good for our immune system. And some of them have antiviral properties, but at that phase, when it's in the inflammatory phase, we need some anti-inflammatory action. And we can get a lot of that from our food, not to neglect that. And to avoid those pro-inflammatory foods, well, most of the things we like to eat, all the sugars and processed fats, the oils and meat and all those kind of things are pro-inflammatory. So avoiding those at that phase, this hasn't been tested. This hasn't been put through a randomized control trial. So I can't say that this will make a difference definitively, but it's good health advice to eat healthy foods and avoid things that cause inflammation in the body. Monoclonal antibodies is something you might want to bring up with your doctor if you're diagnosed with this. This isn't used for prophylaxis as a prophylaxis, but it is used in early treatment. And what we have here, you see these antibodies are what our body makes. And in this case, they're made outside our body and put into us as the monoclonal antibodies. They bind to these spike proteins or other antigens that present themselves on the surface of the virus. And when they bind to them, when they cover up enough of them, that virus cannot enter your cell. So obviously this wouldn't be good past the early phase of infection because they've already entered your cells. And now you have to deal with other aspects of because they have entered your cell. So this is most effective early on, and it's been pretty effective if it's given to the right people at the right time. It's something else to keep in mind when you hear headlines in the news about this treatment doesn't work or this treatment does work. What population are they talking about? People who have been recently diagnosed and have mild disease, moderate disease, or severe disease and are in an intensive care. There's a radical difference in which medications might be effective for each of those. What phase are they in? The viral phase or are they in the inflammatory phase? We use different medications for that. So when they say a medication doesn't work, it has to be specific for a population. These monoclonal antibodies help prevent the entry into the cell. So they're good early on. So who's a good candidate for these? Because we aren't giving them to everybody. They're expensive, but in some places they're even going unused. Maybe doctors don't know, so you got to let your doctor know. Sometimes we're afraid to let our doctors know. And I'm not afraid for a patient to bring something up to me. I'm not afraid to say, I don't know, there's just way too much sometimes. But then we can put it into the context of everything we've learned and see, is this a right fit for you? Well, let's take a look at it and see. BMI over 35, which is 30 would be obese. So in this case, they're saying if you're considerably obese, chronic kidney disease, diabetes, any type of immunosuppressive disease or immunosuppressive medications, or anybody over the age of 65. It's one of these. It could be any one of these. Now, for those 55 years old, you would be one of the following, could be the cardiovascular disease. You've had a heart attack. Diabetes would probably fit in that picture as well, but hypertension. And it is worse if it's uncontrolled hypertension and uncontrolled diabetes. So if you are a diabetic or have hypertension, it's really important to work on the factors that are promoting those conditions. Chronic obstructive pulmonary disease, and even those between the ages of 12 and 17. I don't believe it's been tested on those under the age of 12. If there's a significant obesity in the childhood obesity or sickle cell anemia, congestive or acquired heart disease, those kind of things, these children would be considered a candidate for monoclonal antibody therapy. Now, supplements and herbs, that's kind of like something you'd expect from a doc like me. I do full spectrum of conventional medicine as well, but supplements and herbs, they can be powerful medicine. And we treat them as if they're just nothing, and sometimes they are nothing, but other times they can be harmful or they can be helpful. Again, it's the right person at the right time, the right phase of a particular illness, to where certain supplements at a particular dose might be right for you. And in line of that, make an appointment with your doctor to discuss the things we're about to discuss. We're going to get into some things, but make an appointment to see if what might be right for you or what dose might be right for you. And if your doctor doesn't know, help them get resources so they can educate themselves on what might be best for you. Ultimately, it's your decision. But don't just think your doctor won't know or won't care. Give them a chance. You can always make an appointment with me if you're a resident in Washington or you are visiting here in Washington. I'm licensed in Washington, so I only do medical appointments in the state of Washington or telemedicine in the state of Washington. You can find me at DRFEL at Revive Innovative Healthcare or the number that's on the screen. That's for medical appointments, but I also do health and wellness consultation and coaching. And you can email me, David at Restored Life Now, or either way, you get a hold of me. We can just determine if you live in the state of Washington or not. It's not that complicated. And I'm offering 40% off for your first visit and your first follow-up. If you sign up, schedule an appointment between now and the end of February. I really want to see you get healthy and get the help you need. Prophylactically, to help you from becoming ill, or if you do get ill, to make sure have the best possible opportunity to stay in that 80% that do not need significant medical intervention. That's my goal, to keep those numbers down. And even if you are and you're in the moderate, I won't withhold in either in consultation and in coaching, the difference is the medical one's a full medical appointment. Diagnoses, tests, prescribing, bill insurance, if your insurance covers my services. But the coaching one, we don't do that diagnosing part. We don't do that, but we do a lot of education and discussing your options that you can take to your doctor, and information and understanding, so that you can be armed and equipped with whatever you need. So let's look at some of that. Vitamin C, is it any good? Well, vitamin C has a strong history of antioxidant. Remember, I mentioned that earlier with food. Please eat your foods, unless you're allergic to citrus. Eat your citrus and other fruits that contain vitamin C. You're getting more than just vitamin C when you eat those. But supplementing with vitamin C is generally considered safe. You get up a little bit too high, it can affect your bowels and cause loose stool. They are doing very high dose vitamin C intravenously in some hospitals in randomized control trials, which is really promising. The results that they're getting, but those are super mega doses that have to be done in a proper setting. And I would even say not even an outpatient setting for that, or it could be the right outpatient setting, but the amount of vitamin C you're getting, it's an acid, remember, it's not like a super strong acid, but you're putting that into your veins and keeping that balanced, and the way your body reacts to it, you want to have somebody knowing what they're doing if they're going to administer that through IV. But the super high dose, you can do moderately high doses and IVs fairly safely with people that know what they're doing. Oral, a gram or 2 grams a day is typically considered safe orally. I prescribe more than that for some patients. Vitamin D, we're all familiar with that. We've talked about it a lot. The upper limit that is recommended by the Endocrine Society without doctor supervision is 4,000 international units, or 4,000 IUs a day. That's their safe upper limit. Others would go a little bit higher than that. I regularly prescribe higher than that. There have been trials done on people as much as 50,000 IUs a day for a short period of time, even related to this. And they didn't find any negative effects from people, but it can cause certain problems, especially if you have certain diseases like kidney disease, and things that might have to do with regulation of calcium. So it's not something I would just recommend you do, but get your levels checked if you want, but insurance probably won't cover that. But seriously, you might need more than what you get from a multivitamin. So consider talking with your doctor about upping your vitamin D status. It's generally safe to go 2,000 or 4,000 IUs, especially if you live in these northern parts like I do, where you don't get much sunshine any time of the year. And most of us don't get enough sunshine anyway. Quercetin is a very interesting one. I really like quercetin. You have enough of it and it'll make you kind of stink. But it's real prevalent in onions. Onions are a great source of quercetin. I don't think there's a smelly part of onions, but quercetin has been looked at and theorized. It has been studied in the Ebola, been found to be effective in treatment and intervention in Ebola and influenza at particularly high doses. And in vitro studies, it's been found to be effective as an antiviral agent. And so they just recently did a review of some of the literature, and they said that, it's looking like it is effective, and it's generally safe at the low doses, 500 milligrams or 250, 500 milligrams a day. It's generally safe at that dose. I'm not recommending you take that particular dose, but something to take to your doc and say, is it safe for me to take 500 milligrams, 250 milligrams? It's been found by some doctors anecdotally to be helpful in the prophylactic phase. And also it's a great, very powerful antioxidant. And this study looked at it in combination with like vitamin C and D, and the combination of them might be effective. It was not a randomized control trial. It was it was a literature search and looking at what quercetin has done in the past. So NAC is another one I really love. Being a respiratory patient myself, NAC is a great, could be great at breaking up the mucus in the lungs. It can be very powerful at that. Again, 500 milligrams a day should be safe for most people. I will prescribe significantly higher than that for certain populations, and less for others. So NAC is N-acetylcysteine. It's used in making glutathione in the body. And glutathione, you might have heard of it. A lot of people try to sell you glutathione. It's really expensive. Liposomal glutathione. People make a lot of money off things like that, where NAC is pretty cheap. And most people can make their glutathione if they have the NAC and eat a healthy diet. They can make the glutathione. Some people maybe can't. So NAC is something that is a great antioxidant to get rid of and help keep in balance those reactive oxygen species, as they're called, ROSs, that form as our cells are damaged in the later phase of dealing with the coronavirus. So zinc is also found to be helpful with many antiviral properties at getting and inhibiting certain proteins in the cell from allowing RNA replication, viral RNA replication. But again, you shouldn't get too much zinc. I think now the recommendation is not more than 40 milligrams of elemental zinc. So you got to look at each of your zincs. There's different forms, zinc picolinate and other forms. You got to look at how much elemental zinc is in there. And I would not recommend going over 40. And if you have any questions about that, please look into it deeper. Now, one of my favorite things is herbs. I really like herbs. I studied the type of medicine I studied in part because of herbs. And there's an herb in particular that, well, first I want to mention about herbs is they're not these benign little things. Yeah, you have a cup of herbal tea with a tea bag. You're not getting much of anything. It tastes good. You're getting a little bit of something good for you, but it's not really a medicinal dose. It's not what we would use in medicine, or traditionally what was used in medicine. But there's been a lot of research into many herbs that have antiviral and immune modulating or immune stimulating effects. And there's a long history of research in it. And some of them, most of them, been researched with influenza, like Andrographis and Eleutherococcus have been researched with influenza. Now, my caution is with herbs that are immune modulating or immune stimulating is you don't need your immune system stimulated in the later phases. It can be harmful to stimulate it. You already have an immune reaction going on with too many cytokines, and our immune system may need to be tampered down. That's why we use steroids like prednisone and other steroids in the middle to later phases with people, is to keep the inflammatory phase down. Some herbs are great at immune modulation, but which ones do which? You're going to hear all sorts of claims by a lot of people. So I am really diligent if I am prescribing an herbal formula or any particular herb to patients, because they're not necessarily safe in every circumstance. Some really stimulate the immune system. And for some people early on in this disease, that could be a great choice. Others modulate it. They do a good job of turning it up and turning it down in a pretty smart way, but does it do it with the coronavirus and the effects of the coronavirus? Those are big clinical questions that need to be answered. But one herb that looks very promising, that has a randomized placebo-controlled trial of about 300 patients in Pakistan, is the black cumin. Simple black cumin. It was actually black cumin in honey, but this is a pre-published study. But the statistics from this study look very promising. It's still being reviewed for publication, but it looks very promising. Honey and black cumin had a significant effect in this one randomized placebo-controlled trial. Granted, let's say it is a phenomenal study and done precisely and everything, it's still only one trial and one population. So it needs to be studied further. But there's promising evidence with this particular one. And like I mentioned, Andrographis, Eleutherococcus, Glycyrrhiza, there's many herbs that might fit your profile well, but they have effects. Like, for example, Glycyrrhiza is a licorice. It can affect hormones. So you take too high of a dose, it can impact your hormone levels. It can affect lots of things. So these herbs need to be used with caution. And the herbal industry isn't very well regulated, such as the supplement industry is not very well regulated. So there's caution that I have with that. So finding somebody who knows how to walk you through that if you're interested in it, and finding alternatives or getting healthy in any way, or even the conventional route of medicine on how to deal with it, find somebody that you can connect with and that can help connect you to the resources that might be best for you. And hydrotherapy is another one. Hydrotherapy sounds like one of those things that people do when they go out and sit in a hot spring, and sing Kumbaya. Well, that kind of is, but there's actually some pretty solid scientific evidence behind some of it. And hot and cold treatment is really what we're talking about, either hot or cold or a mix of hot and cold. And there's plenty of studies. This one summary of studies does a great job of doing an overview of it. You can go out and take a look at it if you want. A couple of things I want to mention is that what we find is that when we're exposed to heat, just like a fever, but expose ourselves to heat, we have an immune system response. That doesn't seem to be an over response either, at least in most people. It's typically pretty safe. So it causes our natural killer cell number to rise. So early on in an infection or a mild infection, that could be, or in a prophylaxis phase of the infection, of trying to prevent it, that can be very helpful to stimulate that. Cold can do much similar as heat can do. So cold and hot therapy, many people do this contrast where you spend 3 minutes in hot and then like 30 seconds in cold. Make sure your heart can handle this. And if you're doing hot in particular, make sure your blood pressure is not somebody's that goes too low. Be cautious with that, because you sit in heat, your blood pressure typically drops. You get up, especially if you get up too fast, you might fall, you get hurt. Not good. So when I have taken some people through some pretty intense heat therapies, and you're always there to support them, monitor the temperature, make sure their temperature doesn't go too high, doesn't go above 103 or 104. It's like a simulated fever. But check with your doc to make sure that's safe for you. But it can be very effective at stimulating our immune system. And it can feel good too and help you relax and maybe get you a good night's sleep. Although heat before bed is not necessarily the best thing either for most people. Most people, their bodies need to cool down in order to sleep. Well, if you have any questions or you want a topic, you want me to cover a topic, I know I went over a lot of things today. I went over them fast. If there's a particular topic you want me to dive deep into, write it in the comment section. Contact me. Let me know if I can be of any service to you whatsoever. I am offering a deep 40% discount to help you going into this new year get on the right path to stay as healthy as you possibly can. Well, I hope you share this with your friends and share some good cheer with them too. Give somebody a hug who's close to you and your family. And one last thing I want to mention about if somebody does get sick in your house, something else you can do as you isolate them is let fresh air flow in your house. Fresh air is so important. Even if they're not sick and you're in any environment that you're in, you're going to have people around you. Open up a window, get a little fresh air blowing in there. All right. So with that in mind, I hope you have a blessed, safe, happy new year. And I look forward to hearing from you and getting together again soon with you. Please leave me a comment. Thanks. Bye.